In this chapter, we will be taking a closer look at the spine. Neck strengthening is extremely important to prevent your cervical spine from injury. In sports, we see a variety of neck injuries, both acute and chronic, which often occur due to bad technique and posture. When an athlete has bad posture in the neck, it can put you at a high risk for cervical fractures, dislocation, and whiplash. For example, if an athlete has acute torticollis, which is something athletes sometimes can play through, it can make them more susceptible to injury if they were to participate in an activity, especially in a contact sport, due to the lack of range of motion. Proper technique refers mostly to football, instructing athletes to tackle with their heads up instead of flexed, which can cause more serious injuries such as fractures and dislocations if an axial load is applied in this position. Low back pain is a condition that is very common in all ages. It has become more common due to the sedentary lifestyle of almost the entire population, which causes the core and spinal extensor muscles to weaken and puts stress on the vertebrae. Low back pain is seen in most sports, cross country, track and field, baseball, etc., due to the impact of running and twisting, like hitting a bat, or in field events such as hammer or discus. An alignment that is needed to be checked during the evaluation is leg length. It is very common to have a leg length discrepancy where one leg is longer than the other. This is caused by a structural or functional deformity. In a structural deformity, it's caused by different femur lengths, in which case heel lifts are used to help even the legs out. In a functional issue, there is a muscle imbalance between the spinal extensors and the hip flexors, quads, etc., which can cause an anterior-posterior tilt or excessive rotation, resulting in a leg length discrepancy. In every injury, a core stability program or exercise program should be included to help strengthen the core and provide stability to the lumbar spine. Correct lifting technique is extremely important to decrease load on the low back, especially in a squat and RDL exercise. Squatting at the hips and bending at the knees instead of the trunk is crucial in limiting stress on the low back. Athletes that lift with poor technique will often have more motion in the chest when bending forward. A good indicator of proper technique is being able to see their jersey number or the logo of their shirt, which is across the chest, ensuring that the chest is up and they are squatting with their knees. It is also important to incorporate diaphragmatic breathing to help relieve stress on the back and ribs while performing the exercise. A C-spine fracture is an extremely serious injury that results from an axial load with cervical flexion, which decreases the natural curvature of the neck. Any rotation included in the impact can also cause a dislocation. It is common for a level of unconsciousness to occur, but does not always have to happen in a fracture. Immediately holding C-spine in a neutral position is required to limit motion and further injury. Due to the anatomy of the neck and the relationship with the spinal cord, limiting motion is incredibly important to decrease any further damage to these structures. If the athlete is conscious, assessing the extremities with sensations such as pressing down the leg is important to assess for any instance of paresthesia. Athlete must be spine-boarded and immediately referred to the ER for further imaging. Recognizing the position of the athlete can indicate if the cervical spine has been dislocated due to the head being tilted to one side. This is caused by that rotational mechanism. Paralysis is common due to rotational forces stressing the spinal cord. Immediate care is the same as a fracture, spine boarding, and refer for imaging. In these images, the one on the left shows a dislocation of C5. The right image shows the fracture of the vertebrae. Whiplash can be seen in many different sports, regardless of contact versus non-contact. Many times, whiplash presents with the pain in the neck, but can also mimic signs and symptoms of a concussion, such as headache, dizziness, etc. Normally, these cases are sent to the ER to rule out more severe injuries, such as fracture, dislocation, or a disc or cord injury. Acute torticollis is caused by maintained lateral flexion to either side of the neck, causing impingement of the synovial capsule within a facet. The biggest complaint is restricted range of motion with pain when attempting to rotate towards the side affected. Heat and manual therapy is the preferred treatment of this injury. Manual therapy can be painful, however, post-treatment, the individual should be able to have increased range of motion and decreased pain. Tenderness post-treatment is common and manageable. This is a sign of acute torticollis, where the individual will laterally flex away from the side that is impinged. A brachial plexus injury is caused by acute quick stretching or compression of the neck, which irritates nerves of the brachial plexus, commonly referred to as a stinger or a burner. The classic signs that involve a nerve injury are present, such as burning, numbness, tingling, etc. The preferred method of treatment is stretching and stability rehab programming. It is important to be conservative and not return to activity too soon to prevent against more permanent conditions such as neuritis and muscular atrophy. Low back muscle strain are very uncommon, especially in the weight room. It is mostly due to poor mechanics while lifting, jumping, or twisting. The pain and the strain is going to be palpable point tenderness in the erector spinae muscles on the lateral side of the spine. This could be associated with muscle spasms and guarding. A core strengthening program is necessary, as well as gentle progression of stretching to help stabilize the back. As a refresher of the anatomy of the back, this slide highlights the obliques, serratus posterior, lats, and erector spinae, all which can be involved in a low back muscle strain. Sciatica is a condition that can be caused by acute or chronic injuries and can potentially be permanent. The nerve symptoms can linger just in the glutes or radiate to the knees or even down to the foot. NSAIDs are a common treatment, as well as rest and nerve glides. Traction can also provide relief. Further imaging could be needed to rule out a disc injury. A herniated disc can be caused just by normal degeneration. Degeneration of the disc can occur in young adult athletes due to the repetitive stress that the sport can put on the body, depending on the mechanics needed to perform their activity. When evaluating the individual, they will have pain with bending and sitting for extended periods of time and have relief with extension. Having the individual perform a straight leg raise, which will produce pain, as an indicator of disc issue. Core stabilization is the gold standard non-operative treatment for a herniated disc. This video shows how a herniated disc occurs within the lumbar spine, causing the nerve to be pinched. A spondylolysis is caused by the degeneration of the vertebrae, which causes a stress fracture to occur. This is very common in gymnastics and field events. This fracture can cause the vertebrae to slip above or below the surrounding vertebrae. This injury presents with pain localized to the spine, which will increase over time. Conservative treatment is the normal recommendation of care, focusing on core strengthening to help stabilize the hypermobile segments. Progression back into activity needs to be conservative due to the high risk of additional strains and sprains. This video does an exceptional job of breaking down the different conditions: spondylolysis, spondylosis, and spondylolisthesis. SI joint pain can happen due to a myriad of bad mechanics. This presents with palpable point tenderness over the SI joint medial to the PSIS and muscle guarding. It is very common to present with a pelvic tilt or rotation when being evaluated for this injury. Like all other back injuries, core stabilization needs to be the focus of the treatment. Coccyx injuries are mostly a result of a direct blow, normally from a fall or kick. It is very painful to sit since it applies pressure to the coccyx. A ring seat is the proper care, allowing for decreased pressure from sitting. This pain can present for months.